So we are so glad that you guys could join us for this occasion, and there are a few special guests that I'd like to recognize first. So first, Governor Glenn Youngkin and First Lady Suzanne Youngkin, Lieutenant Governor Winsome Sears, Secretary of Health and Human Resources John Little, Commissioner Nelson Smith of the Department of Behavioral Health and Development Services, Delegate Michael Webert, who represents Fauquier Hospital, and his colleagues at the General Assembly who are joining us today. Former Secretary of Public Safety and Homeland Security, Bob Mosier, Fauquier County Sheriff Jeremy Falls, President and CEO of the Virginia Hospital and Healthcare Association, Sean Connington, members of our hospital board of trustees, medical staff, and team members from Fauquier Health, and everyone from the Right Help Right Now team who worked to make this event possible, but more importantly, who are working for the mental health needs of the people of Virginia. And I would also like to recognize the support from our law enforcement and from our EMS. There are a lot of agencies here today, and we welcome you and we appreciate you for being here. So while I've only been in my role at Fauquier Health for less than a year, coming to Virginia is a homecoming for me. I am from here. And it's really a great place to be, and it's a great commonwealth. And it's just a pleasure for me to be able to work with a team of doctors and nurses and staff that truly care about our community and care about how we're taking care of them. So we've been privileged to be here at Fauquier for almost 100 years not exactly in this location. We actually started as a 20-bed hospital downtown in 1925. But today we're a 97-bed hospital with a robust level of acute care services, including advanced imaging, robotic surgery, emergency care, primary care, a dedicated birthing center, a rehab center, an assisted living facility, and much, much more. And every single day, we continue to enhance our care, technology, and services to meet the evolving needs of our patients today and for the next 100 years. And as part of these enhancements, we've been working diligently with our community partners to combat the mental health crisis affecting our state. And this work includes a lot of things. Establishing better communications between our ER and the Virginia Community Services Board, who we work very closely with. Working closely with local police to guide the process around temporary detention orders. Collaborating with EMS to identify those in the midst of a mental health crisis. And remaining committed to enhancing the quality outcomes and increasing patient safety to meet the healthcare needs of our community. But we can't do this alone. And more importantly, our patients should not feel alone in their mental health journey. So our region needs better resources. For patients who require inpatient treatment, for patients who experience delays in treatment due to COVID-19, for elderly patients who are experiencing dementia, for those with substance abuse disorders, for our unhoused neighbors, for uninsured patients and those utilizing Medicaid and Medicare, for those seeking outpatient mental health care, and especially for teens and adolescents on the verge of a mental health crisis. And individuals facing these mental health challenges and more have arrived at our doors. They're our neighbors, our family, our coworkers, our friends, and we firmly believe that mental health care is health care, and they cannot be overlooked or unsupported. When we tackle big issues like behavioral health, we are incredibly grateful to have leaders and resources at the statewide level on our team. This will take all of us working together as a community to truly make an impact on improving mental health for our friends and neighbors. Today's bill signing is a wonderful example of that community partnership and collaboration on a state level. I'm proud of what we've accomplished thus far, and I know we will continue to do even more in the future for our community and for our state. Thank you for being here today, and thank you for your support. I'm pleased to now introduce our Sheriff, Jeremy Falls.
Thank you, Rebecca, and thank you for hosting today's event. I would like to thank the Governor and the First Lady of Virginia for their efforts in relieving law enforcement's burden in dealing with individuals experiencing behavioral crisis and temporary detention orders. Way too often, our resources are having to sit on someone in crisis for several days, waiting for an appropriate location to transport them just to get help. Our resources are better suited in our community enforcing the law. More importantly, individuals in crisis should receive services in a timely manner. I can share a couple examples of the struggles that we have had and that we have encountered. A teenager had been struggling for a while. The family noticed and intervened by setting up an appointment with a provider. However, the appointment was several months away. The teenager continued to get worse, and subsequently, the family called us, the sheriff's office, as a last resort. Another example is when a deputy responded to a call for someone beginning to experience a crisis. The individual wanted to go voluntarily to the hospital for evaluation. Several hours later, she called into our communication center, upset that it's taking so long to be seen. The deputy had to re-engage that individual and ended up having to obtain an emergency custody order. And these are just two recent examples. I would like to talk a little bit about some successes that we are having with our co-responder program. We have been able to work collaboratively with Jim LaGraff from our Community Services Board, Chief Tim Carter from the Warrenton Police Department, which has been key to the program's success. This program has really helped our resources and, more importantly, helped the citizens in need. The clinician will typically respond with our staff, and once the scene is safe, they are able to engage that individual and resolve the situation very successfully for us. More importantly, they are getting the attention that they need sooner and being provided additional resources. The clinician will typically touch base with those individuals reoccurringly to make sure they're following up. By increasing our mobile crisis teams across the Commonwealth, we will reduce the burden on our co-responders as we continue to work together through strong partnerships. With the bills that are being signed today and the other initiatives being provided by the governor's office, like the Right Help Right Now program, this will continue to relieve the burden on law enforcement. We need to continue to improve behavioral health care opportunities and provide more resources for crisis intervention training, for law enforcement, and alternative transportation options. And the work does not stop today. Now it is my honor and privilege to introduce the next speaker. She is a native of Kingston, Jamaica, immigrated to the United States at the age of 6. She is proud to have served in the United States Marine Corps. She is the first female lieutenant governor of the Commonwealth of Virginia. Please welcome Lieutenant Governor Winsome Earl Sears.
Good afternoon, everyone. We are here rightly on this bill signing day. Right help, right now. That means something. And as you know, there are 6 pillars to the right help right now. And what I'm understanding of all the different pillars, to me, what stands out is the part where we're talking about, and I want to make sure I have this right, service delivery innovation. Because delivery tells me that we have a plan, we have a product, we have a program, we have resources. So this is where it really matters. Now, depending on where you are, different aspects of the 6 pillars will matter to you. But for me, it's that we have a product and we're going to be delivering it, and that it's now innovative, which means we've really, really thought this through. And the other aspect that appeals to me is that we're looking at the whole person, and not just the person. We're including the families. We're asking ourselves, who else needs this help? We're asking ourselves, who else can come alongside and make this better? And we're talking also about strengthening the family, because when the person is going through it, it's not just them, it's the whole family. And we have a family here who fully understands that. And so that's what stands out to me. And in fact, it tells me, even more importantly than all that I've said, that somebody has listened. Somebody has listened, and we've heard, and we're delivering it. So it's not just that we're addressing the growing needs of this issue, but that there are some of us who have had this, that we've gone through as a family, the same scenario. And I'm thankful, very frankly, that we have a General Assembly, the whole General Assembly, who was part of making this happen, and a governor who was again making this part of his priority. But even more than that, also a first lady who said, we've got to do something because we've heard that the needs are great, and we're going with the whole person and including the family. And all of you here today, you have played a part in bringing this together because you are part of our service providers, our nurses, our doctors, our volunteers, our law enforcement, our EMS. All of us make this a better program, a better plan, a better product, resources, and thankfully, the best thing I think, right help right now. God bless us all. Thank you.
Ladies and gentlemen, please welcome to the stage the First Lady of Virginia, Suzanne Youngkin.
Good afternoon, everyone. What a beautiful day. Picture perfect. Aren't I the lucky one? I had an escort to the stage. He said, I'm going with you. I said, come on. Thank you, Lieutenant Governor, for your remarks, for being such an inspiration to women and mothers across the Commonwealth. We so admire you and your family. So glad to be sharing in this life experience with you. I really want to thank also Secretary John Littell. We have had the privilege of serving alongside Secretary Littell. He is most definitely a man for this time. He has a huge heart, an even brighter head, and he's going to make a big, big difference for the people of the Commonwealth of Virginia. We also want to thank, yes, you are amazing. I want to thank Commissioner Nelson Smith and everyone who's part of the Right Help Right Now team. You make us proud. You're endeavoring mightily, and we are 100% behind you and know that great things are going to happen. I want to give kudos to our amazing General Assembly members that are here. I have been so inspired by the collaboration and the camaraderie that is springing out of Right Help Right Now. It is problem solving at its best, and it's unity parties at its best. And I hope that we continue to endeavor hand in hand. We thank you so much as we increasingly endeavor to focus on the well-being of the citizens of the Commonwealth of Virginia. It is not lost on us that it is a great challenge. Today, the numbers in Virginia demonstrate that accidents and suicide are right at the top of the list of the deaths of Virginia's children. That's heartbreaking to us. Glenn and I lost a very dear family friend last summer, Charlie, and his family is from Alexandria, and we continue to mourn with them. But we are trying to honor Charlie's legacy in endeavoring in things like Right Help Right Now. I want to thank the Watson family who is with us. We will keep Big B or Brody in our hearts. Thank you for your bravery. Thank you for your advocacy. We know that on the eve of Father's Day, this is a difficult time, but we are with you, Ashley and Wendy and Avery, and everyone who is here to honor Brody's legacy. We're also just so incredibly encouraged again by our law enforcement professionals and our healthcare professionals
who work tirelessly day in, day out to make sure that they protect the most vulnerable. And we're so deeply grateful to you. And I just want to again reiterate that as a family, we are really endeavoring daily to make Virginia a bit brighter for those who need a little bit of hope. Thank you for being here today. Every single person that's standing here has a role to play and has stepped into that role, and we appreciate you. So please help me welcome, well, not to the stage, he's on the stage with me, to the podium, my husband and your 74th governor, Glenn Youngkin.
Well, good afternoon, everybody. And I hope you're going to stand up because I'm going to ask you to stand up again. So it's Flag Day. And I just want to interrupt for a minute. And I think we should honor our flag with the Pledge of Allegiance. And I'd ask my friend Bob Mosier to come up here and lead us in it, if it's okay. If it's okay with you. Yeah, I'm going off script, folks. It is Flag Day, and we should do this. So I've been saying frequently, I'm encouraging Virginians to sing our national anthem loudly, to state our pledge boldly, and to honor our flag daily, and particularly today. So
Thank you,
over to
Governor.
you, sir.
Thank you, sir.
Good to see you.
Good to see you. Please join me in the Pledge of Allegiance. I pledge my allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
God bless you, sir. Thank you. Always. To my dear wife, Suzanne, thank you. Thank you for your compassion and your passion in helping us collectively not only recognize the challenges that we face today, but also addressing them. And so thank you. Today, we are taking additional steps to transform our behavioral health system in the Commonwealth of Virginia. And I couldn't be more motivated than to see all of you here today collectively, not just recognizing the challenge and the solution, but also marching forward to meet those challenges every single day. Delegate Weber, thank you for hosting. Where are you? I know you're here. There you are. Thank you for hosting. And I know we're in your home district, and so thank you. We're very pleased to be here. And I want to thank all the rest of our General Assembly members. I'm going to, if I miss, raise your hand. But I know that Delegate Watts is here, Senator Cosgrove is here, Senator Bell is here, now Director Davis, but Chairman Davis. And so thank you, sir. Who did I miss? Oh, Tony. Hey, Delegate Wilt, thank you for being here. Thank you so much. And I also want to thank Rebecca for your very kind welcome to all of us and for hosting us here at Fauquier Health. We appreciate the work that goes on every single day here. One of the things that you didn't hear from our Lieutenant Governor, who inspires me daily, is why she's so passionate about behavioral health. And she has lived through some really tough times. And that's why she's such a great partner in all of this. And Winston, I just want to thank you. You're amazing. Thank you. Sheriff Falls, thank you for your leadership. And I know alongside my friend Bob Mosier, you all have transformed the way Fauquier County addresses the kinds of challenges that you outlined. I mean, it was right here that then Sheriff Mosier instituted the groundbreaking co-responder model. And it's a model that, as you described, has police accompanied by a licensed counselor in order to identify a behavioral health issue or episode before there's a crisis. And friends, this is just so important. We know that at the end of the day, a behavioral health crisis can criminalize a moment that may otherwise be avoided. And so thank you for the innovation of this approach and the success of it, both of you. We're also joined today by Rockbridge County Sheriff Steve Funkhauser. And Steve, where are you? I know you're here. There you are. Bless you for being here today. And thank you for your leadership on our temporary detention order task force, which, along with Richmond Sheriff Irving and Antoinette, are you here? I know you were supposed to be here, but you may have not been able to make the whole trip. And I also know the Chesterfield Sheriff Carl Leonard has been deeply engaged as well. When we bring in our law enforcement heroes and leadership to work side by side on how to address a recurring problem that we've been hearing about for so long, which is TDOs are important and necessary, but they also routinely capture so much time from our law enforcement professionals who could otherwise be out doing so many other things. And so this group has gone to work on our task force in order to try to streamline and make sure that we are not unnecessarily capturing so much of that time. The reality is that, of course, it happens. And I just want to thank everybody for the great work that you've been doing. And I'll share some of the breakthroughs that we've had. But it is a testament to your unwavering commitment to make things better. And from the day that I was elected, I can't tell you how much I appreciate so much of the partnership that we have with our law enforcement leaders across the Commonwealth of Virginia. We have a clear opportunity that stretches beyond law enforcement challenges, a clear opportunity to in fact bring together these resources in order to address so many of these challenges. That is what the Right Help Right Now initiative is all about. It's comprehensive. It's about changing the way we think about behavioral health. It's about changing the way that we're structured. It's about bringing resources. It's about changing processes, changing workforce, and bringing it all to a whole new level that the Commonwealth of Virginia has not seen. I mean, let's just be clear. On temporary detention orders, many of our law enforcement heroes doing their duty find themselves on average for 51 hours serving a TDO. 51 hours. And that's not just a problem for our law enforcement heroes. It's a huge problem for Virginians who are in need of help for 51 hours. Friends, we can do so much better. We can do so much better. And so this is why we set out to address these challenges on day one, because these challenges affect all Virginians, rich, poor, young, old, families, friends, all races, rural communities, urban communities. And the reality is that our behavioral health system is being overwhelmed. It's being overwhelmed. And we have to respond. We have to respond with capacity. We have to respond with a larger workforce. We have to respond so that we can, in fact, bring the resources to address this. You've heard about the work that has been led by Secretary John Littell, and I want to add my thanks to your leadership, sir. We have developed a comprehensive plan to fundamentally change the way that Virginia addresses behavioral health. In December, we all stood together. Many of you were with us. And we introduced the Right Help Right Now plan. And on the most basic level, it is about getting Virginians the help they need right when they need it. Building capacity, pre-crisis, in crisis, post-crisis, supporting law enforcement, schools, universities, in the workplace, expanding our workforce so that we, in fact, have the professionals who care so deeply about serving Virginians in the numbers that we need them. It's a three-year transformative plan. It requires legislative enablers. It requires process overhauls. It requires building capacity. It requires teamwork. It requires all of us to come together and march forward in a transformation of a system that serves all Virginians. So today we're taking a big step. We're taking a big step by signing so many of the bills that enable fundamental parts of the Right Help Right Now program, targeted towards TDOs and bringing not just relief to law enforcement, but much better service to Virginians, targeted towards making sure that commercial insurance coverage is extended to cover the services that we are talking about, particularly mobile services, extended to make sure that workforce is being broadened so that there's access for folks who are gaining their license and their accreditation while they're going through the process to come to work now. We need you. We need you. Improving information sharing, making sure that our community service boards and other providers have transparency on their performance, and to make sure there's mutual accountability. This is a package of 22 bills. And let me speak specifically to a couple of them. House Bill 2216 and Senate Bill 1347. And many of you know that oftentimes Virginia legislation will have a House bill and a Senate bill. And by the time we're done, they say the same thing, but they've made their way through both houses because it's important. It's important. And these two bills mandate that behavioral health crisis services will be covered in commercial health insurance plans. Folks, this is critical, critical. We are leading the nation here. Now, mobile crisis services in the community and residential crisis stabilization services and emergency room alternatives will be covered, regardless of your insurance. Imagine for a moment if an ambulance was not covered by your health insurance. This bill brings parity between mental health and physical health, and it's a giant leap forward in creating a better behavioral health system. So if you're experiencing a behavioral health crisis and you need help, you should get it right away. And you shouldn't worry about whether your insurance covers it or not. This bill passed unanimously, and it's a testament of what we can do when we come together and lock arms. Republicans and Democrats, senators and delegates, doing the right thing to help Virginians right now. I want to thank Delegate Leftwich and Senator Cosgrove. Thank you, sir, for your championship and championing of this most important legislation. The next two bills help build a stronger crisis response infrastructure while offloading the extreme burden on our law enforcement. Key pillars, as you've heard, of Right Help Right Now. House Bill 1976 and Senate Bill 1299, patroned by Delegate Bell and Senator Deeds. They authorize the director of a facility to release an individual under a temporary detention order, a TDO, when a local community service board determines that that person no longer meets commitment criteria and that release is appropriate. You see, so often these decisions are delayed, held up by availability, and before you know it, we have a Virginian and a law enforcement hero sitting together for an extended period of time. Too many of our law enforcement heroes, as a result, sit in the emergency rooms as patients wait for care. This bill creates a responsive process to release a TDO to streamline patient flow in our emergency departments and alleviate the burden and get faster care. I'm grateful to all of the community partners who worked on this bill, and I look forward to continuing to improve the efficiency of this system. House Bill 1792 and Senate Bill 1302, patroned by Delegate Ranson and Senator Deeds. They allow an ER physician to go directly to a magistrate to get a medical TDO for someone who's intoxicated so that they can get help and be released within 24 hours. See, under the old law, our ER physicians needed a judge to approve the TDO. Now we can do it directly with a magistrate who is going to be much more accessible. And once again, reducing timelines and increasing support for Virginians. This bill streamlines that process. The collection of the work that's been done, yes, legislatively, but also by collaborating with law enforcement, helping solve these problems, has reduced by 28% the TDO wait list since December. And I want to say that again, a 28% reduction in the TDO wait list since December. And I want to thank our prompt placement TDO task force for the work that you guys have done. So additional bills that we are signing today fortify our behavioral health workforce by optimizing staffing models and serving patients by delivering the right care right now, by making sure that we are taking full advantage of all qualified professionals who can go to work today and support Virginians. See, the truth is, I haven't met a single person across this extraordinary Commonwealth of Virginia who has not been affected by a behavioral health crisis, substance use disorder, a fentanyl poisoning, or overdose. And let's just let that settle for a minute. This is our reality. And so this legislation comes at a time when Virginians are hurting and need support. I'm so grateful and thankful for the Watson family. The First Lady mentioned their entire family earlier. They're here with us, and they spoke up about the tragedy of losing their son, Brady. And that inspired House Bill 1592 and Senate Bill 1072 that were patroned by Delegate Davis and Senator Bell. A bill that requires the notification of parents within 24 hours of bullying incidents at school. Friends, parents need to know what's going on in their children's lives. And there is now a 24-hour requirement so that parents can be engaged and hopefully save the life of the next Brody. Again, I want to thank the Watson family for your courage in helping us prevent a future tragic loss. Thank you. Thank you. So while today represents a big step forward in delivering care, delivering hope and compassion for Virginians, so much work lies ahead of us. We're taking critical steps for all Virginians, Virginians of all ages in schools and the workplace and in our communities. We've committed more resources at the community level to create more robust statewide crisis infrastructure. You see, jails and hospitals are rarely the place to address the issues that many behavioral health patients have. But now's the time for us to stamp with both feet on the accelerator. We've got to move faster. We must continue to drive transformational change. And that's why the budget that I introduced, the amendments, included $230 million on top of the $430 million that were already incremental, for a total of $660 million to invest in mobile crisis teams. I want the entire state to be fully staffed on mobile crisis teams, on crisis receiving centers, on short-term crisis beds, on workforce development, on all of the things we know we need to do in order to invest in capacity pre-crisis, in crisis, and post-crisis for older Virginians, and particularly for younger Virginians in schools, so that they can have access to the right help right now. I say this with absolute clarity. We need a budget. We reported yesterday that we are well ahead of our financial case for this fiscal year and for next. We expect in excess of a $3.6 billion surplus. That's after cutting taxes by $4 billion last year. There's plenty of money in the system. We can reduce taxes by $1 billion, and we can invest $2.6 billion in the things we know we need to invest in: law enforcement, behavioral health, education. And of that $2.6 billion to invest in those priority items, we're calling for $230 million on top of the $430 million to fund this transformation in our behavioral health system. Send me a budget. I ask our Senate Democrats, come to work. The House Appropriations Committee is ready to go. And we need our Senate Finance Committee to go to work. See, this isn't about Republicans and Democrats. It's not about the Senate and the House. It's about Virginians. Virginians can't wait any longer. Let's go to work. This plan is comprehensive. It's based on input and feedback and best practices. We have had thousands of advocates provide their input into Right Help right now. This is about the collective transformation of a system. No one should be alone. And we can make sure that they are not. And so, at a time when we know there's so many people that are in need, we need to be there. At a time when we recognize that there are folks that have appointments that are months away, not days away, we need to address that. At a time where we need more professionals in order to provide this baseline support, we must address that. Friends, we can do it. And we can provide the right help right now. I want to thank all of you for being here today. I want to thank you for believing in the future of the Commonwealth of Virginia. I want to thank you for serving Virginians and caring about Virginians. I want to thank our heroes from our law enforcement community for all that you do to be the first responder. God bless you. God bless all of you. So now it's time to go to work. There's a bunch of bills, in all candor, because there's so many of them, I signed all of them this morning. But what I'd love to do is I'd like to invite up all of the folks who are here, our first responders, so many folks that work in this great Fauquier health community. Many of our friends. Come on, let's go. Come on. And let's all come up here and let's just. I'd like to stop and just recognize that these bills are unlocking so much of our future. God bless you all, and thank you so much.
Can I take you? Can I take two? And be very careful, I'll help you. Take it back. And we're going to do a wide shot, so if everybody faces out this way, we'll get you all. Yep. Right. Perfect. And get everybody in nice and tight. Right help right now. Everybody, one.
Right help right now.
If I can get everybody to look at this camera. Absolutely.